Today, we have a crucial topic to discuss: the warning signs of blood clots. Now, before we dive into the warning signs, let's start by understanding what blood clots are and why they're so important to recognize. Blood clots are a natural part of the body's healing process. They form to prevent excessive bleeding when we get injured. However, problems arise when these clots form inappropriately, leading to potentially life-threatening situations. Blood clots can occur in the arteries and veins, disrupting the normal blood flow. Blood clots don't always come with a warning. They can silently develop and, in some cases, be a silent threat to your health. That's why it's crucial to be aware of the warning signs, especially if you fall into certain risk categories. Factors such as a sedentary lifestyle, smoking, obesity, certain medical conditions, and genetic predispositions can increase your risk. If any of these apply to you, stay tuned. This information could be a game changer for your health. The first warning sign of blood clots is swelling. Let's start by addressing why swelling occurs when blood clots form. Blood clots can impede the normal flow of blood in veins, causing a backup. This results in increased pressure within the affected vein, leading to fluid leakage into the surrounding tissues. The accumulation of fluid causes swelling, and this can happen anywhere in the body. One of the most common areas where swelling occurs due to blood clots is in the limbs. It's crucial to pay attention to any unexplained swelling, particularly in one leg or arm. This swelling is often accompanied by a feeling of heaviness or tightness in the affected limb. If you notice a sudden change in the size or appearance of one of your limbs, it's time to take it seriously. The swelling associated with blood clots is not just about size. It's important to be aware of additional signs and symptoms that may accompany the swelling. The skin over the swollen area might become warm to the touch, and you might notice red or discolored skin. Next up on our list is tenderness. Tenderness is often localized to specific areas where the blood clot is forming or causing obstruction. Common sites include the legs and arms. If you experience tenderness, especially in conjunction with other symptoms we'll discuss shortly, it's crucial to pay attention and not dismiss these signs. The intensity and persistence of tenderness can vary. Some individuals may describe it as a dull ache, while others may experience sharp or stabbing pain. It's important to note that the tenderness may persist and could worsen with movement or touch. If you notice such changes, it's essential to consult with a healthcare professional promptly. If you're experiencing tenderness that raises concerns about a potential blood clot, don't hesitate to seek medical attention. Healthcare professionals may conduct imaging tests, such as ultrasounds, to confirm the presence of a blood clot and determine the appropriate course of action. Next up, we have redness or discoloration. Redness or discoloration related to blood clots is often localized to specific areas where the clot is forming or causing obstruction. Common sites include the legs and arms. If you notice unexplained redness, especially if it's accompanied by other concerning symptoms, the intensity of redness can vary, ranging from a subtle change in skin tone to a more pronounced and noticeable discoloration. The pattern of redness may also provide valuable information. For instance, a streaky or linear pattern might indicate a clot affecting a specific vein. Redness or discoloration is seldom an isolated symptom when it comes to blood clots. It's often accompanied by other warning signs, such as swelling, tenderness, and warmth in the affected area. Recognizing this combination of symptoms is crucial for an accurate diagnosis and timely intervention. Understanding the risk factors for blood clots is essential. Conditions such as obesity, a sedentary lifestyle, smoking, certain medical conditions, and a family history of blood clots can elevate your risk. If you have any of these risk factors, being vigilant. About redness or discoloration is especially important. Next up, we have changes in varicose veins. How changes in varicose veins can serve as a warning sign. Understanding these nuances is pivotal for anyone looking to prioritize their vascular health. Before we explore how changes in varicose veins can indicate a potential blood clot, let's first understand what varicose veins are. Varicose veins are swollen, twisted veins that often appear blue or dark purple. They usually occur in the legs and can be a result of weakened valves and increased pressure on the veins. Varicose veins themselves are not always a direct indication of blood clots, but changes in these veins could signal a problem. When a blood clot forms in a vein, it can disrupt the normal blood flow and lead to changes in the appearance of varicose veins. These changes may include increased swelling, discoloration, or a feeling of heaviness or pain in the affected area. One of the noticeable changes in varicose veins that might indicate a blood clot is swelling. If you observe a sudden and unexplained enlargement of your varicose veins, it could be a sign that blood flow is compromised. Pay attention to any changes in size, as well as the associated symptoms like warmth or tenderness. Changes in color can also be a crucial warning sign. If your varicose veins start to exhibit unusual redness or discoloration, it might suggest that blood clots are affecting the normal circulation in the area. Discoloration can be subtle, so it's essential to regularly check for any alterations in the appearance of your varicose veins. Next up, we have cramps when walking. Let's briefly discuss why cramps happen. Cramps occur when muscles contract involuntarily, causing pain and discomfort. During walking, the muscles in your legs are actively engaged, and if there's an interruption in blood flow due to a clot, it can trigger cramping. Cramps when walking can be indicative of vascular complications, particularly when associated with other symptoms like swelling, tenderness, or changes in skin color. Blood clots can obstruct normal blood flow, leading to reduced oxygen supply to muscles, resulting in cramps and discomfort. The location of cramps can offer valuable insights. If you experience cramps primarily in one leg during or after walking, it's a red flag worth paying attention to. Moreover, the persistence of cramps is essential. If they consistently occur and are not alleviated with rest or stretching, it's time to consider a potential vascular issue. Cramps seldom appear in isolation when blood clots are a concern. They are often accompanied by other symptoms, such as swelling, warmth, or tenderness in the affected area. The combination of these signs creates a more comprehensive picture that healthcare professionals use for accurate diagnosis. Understanding your risk factors is crucial. Conditions like obesity, a sedentary lifestyle, smoking, certain medical conditions, and a family history of blood clots can elevate your vulnerability. If you fall into any of these categories, it's important to be vigilant about potential warning signs like cramps when walking. Last but not least, we have loss of vision in one eye. Loss of vision, especially in one eye, is a serious and potentially alarming symptom. While it can be attributed to various causes, including migraines or eye conditions, it's crucial to be aware that blood clots can also lead to sudden vision changes. Understanding this connection can be pivotal for early intervention. Blood clots that form in the veins can impede blood flow to the eyes, leading to a condition known as retinal vein occlusion. This disruption in blood supply can result in sudden, painless vision loss in one eye. The severity of the vision loss can vary, and it's essential to recognize this symptom as a potential medical emergency. Vision loss due to blood clots may not always occur in isolation. It can be accompanied by other symptoms, such as headaches, dizziness, or changes in perception. These additional signs can provide valuable context and aid healthcare professionals in determining the underlying cause. Understanding the risk factors for blood clots is crucial. Conditions such as atrial fibrillation, a history of stroke, diabetes, high blood pressure, and smoking can increase the likelihood of blood clot formation. If you have any of these risk factors, it's vital to be vigilant about any sudden changes in vision. It's worth noting that age and gender can also play a role. Certain age groups, particularly those over 50, are at a higher risk of developing blood clots. Additionally, women, especially those taking hormonal contraceptives or undergoing hormone replacement therapy, may face an elevated risk.